Hi everybody, today I'm going to be talking about the nursing process. The nursing process is a fundamental concept that you're going to learn in the beginning of nursing school, you're going to use it throughout nursing school, and really you're going to apply it once you get into your clinical setting. This is something that's imperative that you understand because the nursing process is what we do as nurses. You're going to be using this once you graduate and even get into the field with your own job. So this is something really important that I want to make sure you understand. There are 5 steps to the nursing process, and I'm going to go through each step in great detail. So these are the 5 steps to the nursing process, and the best way to remember them is if you take the first letter of each section and put them together in order, you get this nice acronym, ADD-PI. And I even added some pi in the bottom corner so you could remember. This is just something somebody created one day. I don't really know who did it, but thank you because it has tremendously helped me remember quickly the steps and what each of them means. So let's get started in great detail about each of the steps. The assessment step. This is all about data collection. There's a lot of different components to data collection, so you could be just looking at the chart data. So that could be reviewing the nurse's notes or the current doctor's orders, their medications that they're currently taking, any labs that they recently had done. You could look at some x-ray imaging if they have it in there, or EKGs, and any vital signs, any recent trends in their vital signs that you are noticing. So have they been hypertensive lately or hypotensive, anything like that that you can see just from their chart. Or you could talk to the patient and gather data like that. So that's a client history. You could interview the patient. So that's just talking to them, asking them different questions. That's also gathering data. Another way to gather data is to do a physical assessment. So that could be a laboratory test or some type of diagnostic procedure. A physical assessment could also be a focused assessment. So are you doing a cardiac assessment? Are you listening to the heart? Are you listening to the lung sounds? Are you listening to their bowel sounds and assessing their stomach? So that is also collecting data. And another big component of collecting data are these two things down here, subjective data versus objective data. So subjective data is what the client tells you. So what they report, what they believe, or what they feel. So pain is a subjective form of data. I like to think subjective data comes from the subject. So that's right in there for you. That's a little tip to remember. Objective data are things that are measurable, what can be observed. So I like to think that the O in objective and the O in observation can go together. So vital signs are objective, behaviors are objective, diagnostic studies are objective. So anything that you see as a nurse or that can be measured like vitals are forms of objective data. The next step is the nursing diagnosis step. So this is analyzing. We take all of the data that we gathered in the assessment step and we analyze it. We break it down. What's important, what's not important. And then we form a nursing diagnosis. And I want to say now, I'm not going to go through how to form it right now, but I do have a video that talks about and shows you how to create your own nursing diagnosis. So if you want to learn how to do that, go ahead and check that video out. But right now, I'm just going to talk about the general types of nursing diagnoses. So there's 2 types. You have the actual diagnosis and the risk for diagnosis. And another big thing too is that we as nurses, we cannot diagnose our patients. So there's these 2 things over here, the nursing diagnosis and the medical diagnosis. The nursing diagnosis is what the patient needs, the human need. And the medical diagnosis is just that, it's a medical diagnosis. So my best example is if you had a patient come in with, labored breathing, wheezing, their CT scan is showing some spots in their lungs, they have high blood pressure or fever, we can kind of put that together as possible pneumonia. But as nurses, we can't diagnose pneumonia. That's what the medical diagnosis is for. So the patient's medical diagnosis would be pneumonia, but our nursing diagnosis would be ineffective airway clearance. But like I said, I do have another video that goes through how to create a nursing diagnosis, so make sure you check that out. So our goals, once we have gotten our data, organized our data, and picked a nursing diagnosis. Now we put our plans together. How are we going to help this patient? So the patient outcomes are determined by our nursing interventions. And we're going to talk about nursing interventions when we get to this step. But for right now, there's 3 steps in our planning. So first of all, who are we going to do this goal for? That would be our patient. But also, who's going to be involved? Who do we need to help this patient become better? What is the goal? You want to make sure that your goal is documented somewhere. You need to put in there what you're going to do for this patient. And then the time frame. You want to make sure you have a time frame for your goal. You just don't want a single time. It's a lot easier if you put a time frame in there. That way it can for sure be met. If you just put one time in there, there's not a guarantee that you can meet it by that time, because a lot of things can happen in a work shift. So you want to make sure that you put your time frame in there just for a little bit of security. Your goals need to be specific. They need to be realistic. Can a patient who just had hip surgery do cartwheels down the hallway? No. So that's not a realistic goal. You need to consider the client's circumstances and desires. Your patient is a part of the planning step. You want to make sure that you're doing things that the patient thinks they can do as well. You want to indicate a definite time frame, like I said previously. You want to make sure you have that time frame, and you want to make sure it's an appropriate time frame. You can't give a patient an hour. You need to make sure that you give them a couple hours depending on what the goal is. And you need to provide measurable evaluation criteria. So make sure that you evaluate your goals as they happen. And we're going to talk about more of that in the evaluation step. So once we've assessed, made our diagnosis, planned how we need to help the client, we're actually going to do it. So this is all about application. We're going to select appropriate nursing interventions. And a nursing intervention is just anything the nurse does. So the nurse is intervening on the plan of care. That could be direct care for the patient, treatments, or anything that the doctor said to do. That's a nursing intervention. And you want to make sure that these interventions are appropriate. They need to follow your plan of care. You need to promote the client's strengths. You need to make sure that you're being optimistic towards the client, because they're already probably not feeling their best. So you really want to make sure that when you're actually doing these things, that you're promoting the client's strengths. These nursing interventions need to be based on the patient diagnosis. They need to correlate, and it also needs to be based on your planning. You don't want to do something that you didn't plan for, because that could bring up a possible injury risk, or you could even hurt the patient even more. You need to make sure that the client is willing to do the intervention. If they're not willing, they're not going to probably do it. So you want to make sure that they're as involved and as on board as much as possible. And like I said, you need to make sure that it's an appropriate intervention. So our last step is to evaluate, which is pretty self-explanatory. This is all about reassessment. So whether you take new laboratory tests and compare them to your first laboratory test, or you take a new x-ray, or you reassess the stomach sounds or something like that. It's all about comparing. And there's 3 important parts of the evaluation. Was the goal met? Did you meet your goal? Evidence. What evidence do you have that you met your goal? Maybe you needed to get the patient up, and maybe their pain rate went down a little bit once they started moving. So that would be an evidence. Or maybe you took their vital signs, and their vital signs are better than what they did before you started your intervention. So that would be another evidence. And then the last part is either are you going to continue your plan, discontinue, or revise your plan of care. So sometimes things don't work out. It's not always perfect. So you want to make sure that if this is working for your client, then you're going to want to continue your plan of care. If it's not working, you need to discontinue and revise your plan of care. That is completely fine if you do that. You just want to make sure that you document that. A lot of things can happen in a couple hours of time frame. Not everything goes as planned, unfortunately, but what is nice is that as long as you document, You can revise anything and try to help your patient out in the best way possible. Everybody is different, every human body is different, so that's something that will probably happen. And the last big key thing here is to make sure you document everything. You want to make sure that anything that happens, any data, any evaluation, any intervention, that you're documenting it, because you need to make sure that anything that could happen, you have a chance to look back, you have a record of it. So documentation is a really big part of the nursing process. And so that is the nursing process. Hopefully I cleared some things up for you guys. Just please make sure you check out my video on how to make a nursing diagnosis. All right, guys, thanks.